Happy afternoon and a warm welcome to our GarbhaGudi Institute of Reproductive Health and Research. Myself, Muthulakshmi, Academic Coordinator at GGIRHR. It's my honor to take over the platform for today's CME webinar on behalf of GGIRHR. We proudly welcome all the speakers, students, doctors who gathered virtually. General instructions: mobile phones on silent, you will be on mute throughout the session and your videos will be turned off. If any queries, please drop it on chat box. It will be answered at the end of each speaker session. Let's begin today's CME with a brief note on growth of GarbhaGudi. GarbhaGudi was founded in 2011, where a pioneering work was led to the progression and implementation of the latest medical technology and methods to overcome male and female infertility. GarbhaGudi IVF Center is known for its extraordinary and overwhelming success rates, ethical treatment, affordable costs, with world-class infrastructure and humane touch. Now, GarbhaGudi, spanning over a decade, is still serving as a beacon of hope for thousands of infertile couples. GarbhaGudi, which is a chain of new generation infertility treatment hospitals equipped with state-of-art infrastructure and cutting-edge technologies like IVF, ICSI, PGT to address this ever-increasing infertility issues with various causes. Our experienced and dedicated specialists, nurses, and embryologists work to serve our couples' needs and respond them quickly, as one of our GarbhaGudi way tells that a satisfied client is our best brand evangelist, and we aim at delivering results at higher standards. With backing of such a capable and strong organization, GGIRHR, that is GarbhaGudi Institute of Reproductive Health and Research, is providing the preeminent training to the budding clinicians, embryologists, andrologists, and other paramedical staffs to mold them for the challenges of infertility treatment. GGIRHR is affiliated to Rajiv Gandhi University of Health Sciences for Fellowship in Reproductive Medicine, IMA-AMS Indian Medical Association for Fellowship in Infertility, Garden City University for Postgraduate Diploma in Clinical Embryology. We also provide ultrasound scan course and other residential and non-residential fellowship course, which is GGIRHR certified. Students at GGIRHR are trained with tips and tricks, procedures, and protocols followed at GarbhaGudi IVF Center, which has given unbelievable success rates. Now, we are glad to inform you all that we are spread with 7 centers across Bangalore in serving thousands of infertile couples. Without further ado, let's begin today's CME. Our first speaker for the day is Ms. Monisha, who is a dedicated clinical embryologist, possess the expertise and commitment to assist couples in their journey towards parenthood through ART. Today, Ms. Monisha will be taking us through the history of clinical embryology and therapeutic IVF. Over to you, ma'am.
Hello, everyone. A very happy afternoon. So I will be presenting on the history of clinical embryology or IVF and a little bit on a therapeutic IVF. So before going further with the presentation, so we should understand that this IVF or the subject of clinical embryology as a whole was not an overnight success. So decades have like many people or many pioneers for that matter have spent decades with their experimentation and calculations and trials and errors and to achieve this milestone in the biomedical science. So before going into the actual process of IVF or the history of IVF, so we should look back at these scientists or the fathers of their particular field, the medicine or the biomedicine or any other field. So these are like IVF, not even applies to the centuries or the BCs or the ADs. It also applies to the era where in Vedic ages we were able to witness or we were able to understand the process of conception. So in our Indian epics like Mahabharata and Ramayana and everything, so we do have written literature explaining the process of conception and also explaining the process of fertilization, and also to a level where they even describe how an embryo looks. So this is how, from that particular Vedic era, the concept of conception has grown, and to the 21st century, how technology has taken over. So in the 5th century BC, Hippocrates believed that both males and females each produced 2 seminal liquors. one stronger than the other, a blend predominantly with the former would produce a male offspring, latter with a female offspring. So this is the conception in the 5th century BC. So Hippocrates, a father of medicine, once believed in this particular theory. A century later, Aristotle proposed that the first stage of human being was indeed an egg that was found in the females. So people for 1 century believed that there were a blend of two seminal liquors, and in the next century there was another theory proposed. And centuries later, until then, people believed only in these two theories. And in the year of 1672, de Graaf described the follicle and at the same time Leeuwenhoek the spermatozoa. So these were the achievements done by the biophysicians or the biologists or the zoologists at that particular era. So only in 1875, Hertwig demonstrates in the sea urchin that only one sperm cell would penetrate the egg to achieve the fertilization. So until then, the theory or the practicality of fertilization was not explained to the world. So then later on in the year 1786, John Hunter performed the first artificial insemination in humans, and in 1866, Sims the first donor insemination. So this particular person, John Hunter, he was the first person to achieve the first artificial insemination, which in today's date it is considered as IUI. So he was the first person to inseminate a human, a female, with semen sample into her internal os. It is not intrauterine, to be exact. And John Hunter is also considered as the father of these procedures, since he was the one who first initiated it. So later on, with all centuries later, the new age technology, with the new age technology in the biomedicine and with the new age conceptions around the world. So as biologists and other scientists thought about the mystery of conception. So in the year of 1833, the cytologists Van Beneden demonstrated that gametes had only two chromosomes in the Ascaria, which is a kind of a roundworm found in the human intestine. The two chromosomes of the male nucleus would join with the two chromosomes of the female to form the nucleus of a new zygote. So in the last slide, when we learned about Hertwig, he just demonstrated and he said that one sperm is enough to penetrate the egg and achieve fertilization. Here, the cytologists who observed the fertilization process deeply understands the chromosomal activity that is happening inside the zygote or egg at that particular time. And thereby, he laid the foundations for the discovery of the hereditary factor or the hereditary principle, which was first then discussed. So with these hereditary principles, we can think about Gregor Mendel over here, who went on with these hereditary patterns and who went on discovering things or giving his principles to the world, saying that hereditary is with the phenotypes or with the factors that the parents transfer to their offsprings through DNA. So all these, the dates mentioned over here are not very near to each other, because the whole world was studying conception or studying genetics or studying other aspects of science, which they were trying to find out the ultimate goal of any life, to reproduce. So in the year 1903, a Danish pharmacist, Johansen, coined the term gene, and from which 3 years later, Bateson later he defined the new science of genetics. So the introduction of genetics to the world brought in a lot of questions, a lot of investigations that the scientists had were taking care of at that time. So genetics, reproduction, and the amount of science that is involved in the science of reproduction, that is how the field has come up. In 1956, Taijo and Livan identified 46 chromosomes in the human. So why I am stressing so much about genetics and the chromosomal activity in human is this is the basic science for an embryologist to have the basic knowledge about the genetics. So that They will be aware of things, what is happening in the chromosomal level in both the gametes. So as you can see, as the world welcomes joy. So in the early 50s, or in the year early 50s to 78, so almost 28 years of time. So there was this one man, Robert Edwards. So this man is one of the trios of the pioneers of IVF. So Robert Edwards, Patrick Steptoe, and Jean Purdy were the three trio who were able to achieve the unthinkable at that time. They were able to achieve the first pregnancy and the first healthy delivery of a baby girl through IVF embryo. So Robert Edwards had achieved his PhD in in mice oocytes. So his PhD was in the mice oocytes, where he could appreciate the maturation of the oocyte, which was 12 hours in the mice model. So developing his as a biophysician, developing his ideology from the mice model and the animal models, he wanted to bring in the same concept and to help the infertile couple to achieve this in humans. So in 1954, it's just a fascinating story that goes about, and how the world at that time was digging about conception, and trying to build in processes and build in equipments to help the infertile couples and to achieve the parenthood. So in 1954, Tybalt achieved the first fertilization in vitro in mammal in a rabbit model, succeeded in growing rabbit embryos derived from oocytes fertilized in vitro, and in 1959 achieved a live birth by transferring of an in vitro fertilized oocyte. In 1965, Edwards determined that human oocytes removed from ovarian biopsies required 37 hours to complete their maturation in vitro. So this he came across during his 6-week work visit, that he obtained human oocytes, confirmed the precise timing of human oocyte maturation. So as he had obtained his PhD in the mice model, he wanted to go ahead with the same topic to the next level as well. So Edwards had tried unsuccessfully to collaborate with clinicians in Cambridge and London to supply him with human oocytes. Obviously, at that particular time, it was a miracle for him to get a oocyte, that to a human oocyte. So frustrated with these efforts, he thus turned to the US, and in 1965 he had joined Georgiana and Howard Johns at Johns Hopkins, where he could retrieve some of the ovarian tissues from the wedge biopsies, and there he was able to conclude that there was a during this 6-week work visit, that he was able to conclude that the precise timing of human egg maturation was 37 hours. So this particular timing, what he was aiming for, is a very important step in understanding the IVF. So you will understand this in the future slides, why it was so important and why this is considered as a milestone for Robert Edwards to achieve his goal of having an IVF embryo. So around this time, all over the world, the gynecologists and the clinicians were going through a lot of infertile, in the sense they were trying to treat the infertile couple with the tubal blockages or with any other hormonal imbalances. For that particular time, at that particular era, the gynecologists were going around with the different medications which were available at that time, and to try and see which particular medication would work on which particular patient and their hormonal assays and everything. So as the world was concentrating more on understanding the science of conception, in the year 1972, at an IFSS, that is the Fertility Society Congress in Tokyo, Robert Edwards talked about the possibilities of IVF in humans, as he had already achieved that in mice model. So he wanted that to move about, and he wanted that to go about and try those possibilities of having to be done in human model. So at that time, Robert Edwards was struggling to collaborate with clinicians or to collaborate with other laboratories for him to have the access and to have the gametes for him to try out these IVF procedures. So in that time around, there was one more doctor or a gynecologist at the same time. At that time, this is Patrick Steptoe. He was a gynecologist who was working in a small northern town of Oldham and already had much experience in the surgical use of laparoscopy. So until 1972, so laparoscopy for the use of retrieving the oocytes from the female was not developed much. So with the experience of this doctor's surgical use of laparoscopy, this duo or this collaboration was bound to be doing or bound to be achieving that miracle what Edwards had once dreamt about. So Steptoe immediately agreed to collaborate with Edwards, and so began in 1968 the partnership that would leave such a lasting legacy in the reproductive medicine. The story of Edwards and Steptoe is well known, but for them it was also a difficult one. It was that particular age was not well equipped or well technology wise. The world was still growing and the world was still developing materials, or the world was still developing the equipments which are required for medicine as well, in the field of medicine as well. So in that particular age, it was not a easy task for these to understand and also to undergo such difficult procedures, which was not even attempted by anyone at that particular time. And they were the pioneers. They were the first ones to attempt it and succeed in it. So Edwards had to take long drives from Cambridge to Oldham, which was 180 miles each way, the laparoscopic recovery of oocytes from the ovary, the start of embryo transfers in 1971. So after 68 to 71, they were still not able to recover oocytes, which was obviously till date, it is considered as treasures. So from in the year 1971, they started the embryo transfers, the ovarian stimulation with HMG, clomiphene, which is a basic drug which is used in the ovarian stimulation, the luteal phase, and the constant failure until the first ectopic pregnancy in 1975. So 1971 to 1975, 4 long years, they ended up in a pregnancy, but it was ectopic, which cannot be continued. Ectopic is something, the pregnancy which happens not in the endometrium of the uterus, but somewhere else, like in the fallopian tubes and so. And finally, despite of all the accusations and accusations of malpractice and all the other humiliation they had to face at that time by the UK colleagues, and after 32 embryo transfers, from the year 1975 to 1978. 32 embryo transfers were made and one got successful, and Robert Edwards, Patrick Steptoe, and Jean Purdy achieved the first healthy pregnancy that was achieved by a IVF embryo, and then thus the birth of Louis Joy Brown on July 25th in the year 1978. So her middle name was Joy because she had brought a lot of joy to these three people. So Robert Edwards, Patrick Steptoe, and Jean Purdy. So Jean Purdy, the lady in between these two men, she is considered as the world's first embryologist, who was the first one to witness the cleavage of an embryo. So the world started going gaga about it, that there was a super baby in the world, and 3 people in the world had achieved the impossible, and someone could break down the enigma of conception and could achieve this. So the world had gone gaga about it, and even till today, her birth is celebrated as the World's Embryologist Day, and it is proudly celebrated as the World's Embryologist Day. So she is 46-year-old now, and she is healthy, and yes, then and now. And that is the glass chamber which she was conceived in. It's a desiccated chamber that pharmacists use. So from that particular jar to the very well and very precise equipments or the precise consumables what we use, it's quite a journey of IVF. So Born Hall. So after achieving what they had dreamt of, they did not stop over there, and immediately after the birth of Brown, the attention of Edwards and Steptoe turned to extending their clinical work. But Steptoe had to retire from the Britain's nationalized health service at that particular time, and it took 2 more years for them to think of an alternative private service that could be set up at Bourne Hall near Cambridge, which in time would become one of the most progressive and the best known in the world. However, while Edwards and Steptoe planned their move to Bourne Hall, other groups throughout the world were inspired by the UK success and set about their own efforts to repeat it. Obviously, the whole world was trying to break down this enigma of achieving healthy pregnancy out of IVF, the embryo which was grown in vitro. All about the world in like different parts of the world was trying to achieve the same thing, and but the first ones to achieve it was these three people. So, like Edwards and Steptoe, they were contemplating a treatment for tubal infertility with the idea that IVF would circumvent the tubal blockage if tubal surgery had failed. During the same era, or during the same decade, or the same years, in another part of the world, in 1973, not very before the first baby, IVF baby was born. So, 5 years earlier, Doris and John Del Zio became the first couple in the United States to undergo IVF. So, all these all these procedures, or the attempts that were that people were undertaking to achieve the unimaginable was happening in different parts of the world, be it US, UK, or Russia, or even Australia or Japan. So in the year 1973, US had its first infertile couple to undergo IVF. So, but this is a bit of a sad story that we will go through later. Their doctor, Dr. Sweeney, had tried unsuccessfully to repair Mrs. Zio's tubes. So, with the tubal factor, the couple had come for IVF treatment, or the infertility treatment at that time. The only possible option was a radical new idea that was happening in the world at that time, that was in vitro fertilization. So Dr. Sweeney conducted Dr. Landrum Shuttles of Manhattan's Columbia Presbyterian Medical Center and asked him for his assistance in this new procedure. The world had already had idea about these particular procedures that were happening, but attempts were made in private, and also attempts were happening all over the world. And there it is a collaboration between a scientist of biophysiologist and a gynecologist or a clinician. So on September 12th in 1973, Dr. Sweeney removed an egg from Mrs. Zio, and Mr. Zio Mr. Zio's sperm was used, and then delivered the eggs to Shuttle's Columbia Presbyterian Laboratory. The eggs and Mr. Zio's sperms were placed together and then left in an incubator to develop. The transfer was scheduled on day 3. So, however, a day after the insemination, a day after the egg was retrieved from the wife, Dr. Shuttles was called into his chairman's office. At the chairman at that time, Dr. Raymond Van Weel, the obstetric and gynecology chairman, was furious that Shuttles had attempted this experimental procedure without the institution's permission. And unfortunately, the embryos had to be destroyed, or the embryos were not used by these couple. Dr. Van Weel thought this procedure was unethical and immoral. He was also concerned about the safety of the procedure for the patient. So he removed the culture dish from the incubator and ended the couple's hopes of having a child through IVF. So this was obviously a very devastating situation for any parent or any aspiring parent. When the couple heard about the chairman's action, they were very upset, and they went to an extent of filing a legal case on the particular laboratory and the particular chairman who had instructed to do so. So they believed they had lost their one and only chance to become parents. So this is something that we'll have to nurture when we are undergo, like if any couple is into IVF treatment. So there are a lot of emotional and psychosocial problems that the couple will be undergoing. So we'll have to nurture that as well. So a year later in 1974, so the couple filed suit against Columbia Presbyterian Medical Center, and Dr. Van Weel was for $1.5 million. That was the claim by the couple. And 9 years later, when the headlines screamed the news of Louis Brown's birth in England, a defense attorney tried to prevent the jury from being influenced by the success across the ocean. So he compared that the procedure that was happening in UK was quite different, and the procedure that was happening in the US was different from one another. And the jury that was defending chairman or the defending the laboratory did not agree on the particular statement, saying that if that could happen in UK, it could have happened in US as well. So the jury of the couple seemed much more inclined to think that IVF as a medical miracle than as a threat to the civilized society. So when we think of US or the West, we usually think that it is a very broad-minded society, or a society which accepts new things very easily. But even at the time of 1970s, this particular achievement or this particular procedure that could bring up an offspring to an infertile couple was considered as something unethical, and considered was something which was against the society, because at that particular time the only chance of conception was natural, and that was the only conception that people had or the society had, or to this day as well in Indian society. IVF is considered as a taboo. So that is there in the society, which cannot be pulled out from people's mind and gotten rid of. So the trial of this particular lawsuit lasted for 6 weeks, each side making its own making its own sentences about the case, about like the wisdom, safety, and the property of the IVF. And in the end, Van Weel was found to be fault for his arbitrary and malicious behavior, and he and his co-defendants were ordered to pay the couple $50,000. But ironically, or in an ironical twist, so as the world, or in the early 80s, there were many IVF babies being born, and that Dr. Van Weel changed his opinion, the one who had ordered the doctor to destroy the embryos or to take the petri dish from the incubator. He changed his opinion, and feeling changed that paralleled the feeling about IVF that was occurring in the general public. When Columbia University opened this first IVF clinic in New York, and he was the director of that particular IVF clinic. So yes, people had the misconceptions about IVF, and people were not ready to accept the fact. And later on, with the advancement of the technique, or with the live examples or the live births that were taking place, and healthy births for that matter, society started accepting the IVF procedures or the assisted reproductive technologies into their daily life. So this decade, so the year from 1982 to 1992 was a huge was a very important decade, or a very special decade that had a lot of milestones that that scientists had to cross through. So it was a decade with a huge IVF progress, or the huge progress in assisted reproduction. So I will just mention what was the milestone at that particular year. So in 1982, the recognition of poor and high responders to HMG, doctors were looking at different profiles, like one woman is not equivalent to another woman, and the body of one woman will be different from the body of another woman, and the treatment that particular woman will be taking is not equivalent to the treatment another woman will be taking. So the gynecologists started studying more about the hormonal assay, or started breaking down a few milestones by thinking alternatively, and thinking outside the box about the drugs and the stimulations, or how to even stimulate the person. So the recognition of poor and high responders to HMG, the first ultrasound guided aspiration of follicles was had happened in 1982, and the first reports of GnRH agonist use for the downregulation of pituitary hormones in IVF. In 1983, human embryo freezing took place. And in 1984, the first pregnancy following gamete or gamete intrafallopian transfer, that is, the gametes were introduced into the intrafallopian cavity, and the first in 1986, the first pregnancy through zygote fallopian tube transfer, and the first human pregnancy following oocyte freezing was achieved in 1986. And in 1988, the first report of a human pregnancy following subzonal insemination. In 1989, vitrification of human oocytes were achieved. So in 1989. So later on, the world, which is turning into fertility preservation or looking into the fertility preservation as of now, that particular preservation was this particular preservation, what is happening now, wouldn't be possible if in the year of 1989, if those scientists did not achieve the vitrification or the freezing of human oocytes. In 1990, the first live birth following pre-implantation genetic diagnosis, the detection of aneuploidy following polar body testing, and the first description of assisted. So this is the reason why genetics is very much important in the field of IVF or in the field of ART. So as we advanced in the ART or the assisted reproductive technologies, gynecologists or the embryologists were more determined to give a healthy pregnancy than the number of pregnancies that were that were taken into consensus at that time. So genetics of a particular embryo played a very important role for a healthy pregnancy, also compiled with other factors as well. The first clinical use of GnRH agonists for the suppression of pituitary hormones happened in 1991, and in 1992, ICSI procedure came into light. So this intracytoplasmic sperm injection was a technique that came into light, and till date it is sustained and to achieve pregnancies in unexplained infertility, or where the couple is having a androgenic factor for not achieving pregnancy. So this made a major milestone in the field of ART. So ICSI would become the most successful technique introduced in the decade, thereafter applied throughout the world to overcome fertilization failure as a result of a male factor or unexplained fertility. The success of ICSI would also be shown to be independent of these three basic sperm parameters: the motility, morphology, and the concentration of the semen. Throughout the decade, there was a huge increase in the use of assisted reproduction and in its success. In 1986, approximately not more than in 1978, the first IVF baby was born, and within not more than a 2 decade, or more than a decade, approximately 2,000 babies were born following IVF, with half of them conceived at Born Hall. However, by 1989, the first year of data presented in the initial World Collaborative Report at the 7th World Congress of IVF in Paris in 1991, that total had increased to more than 18,000 live births. And at present time, it is more than 12 million babies all over the world. So it's quite a journey from 1978 to 2024. Yes. So there is no presentation or no talk that is complete until we mention our very own unsung hero, Dr. Subhash Mukhopadhyaya, achieved the science, or he achieved this milestone of IVF pregnancy along with Robert Edwards and Patrick Steptoe. It was on the October 3rd, 1978, just a few months later after the first IVF baby was born in the UK. So, but unfortunately, he did not get enough support, or he did not get enough, support and support from the government and stuff for him to continue his work. And if he had continued his work, we would have, India would have been one of the pioneers in the world of ART. Yes, so speaking about Dr. Subhash, in from 1967 to 1975, he worked at an RS hospital in Calcutta, where he started developing all these procedures. When he learned about the procedures that were happening around the world, and he got his PhD from the University of in the same university where Edwards also got his PhD. And he did his PhD in mice models to achieve his IVF pregnancy and stuff. He actually was a cryobiologist who was trying to achieve the embryo vitrification. And the world's first IVF baby was born in on July 25th, 1978. And on October 3rd, 1978, India's first test tube baby was born to Pravat Kumar and Bela Devi Agarwal after prolonged treatment under Dr. Subhash. So, unfortunately, unfortunately, he ended his life in the year 1981. He committed suicide because of the lack of support he got and the lack of recognition he got for his work. And 16 years later, Sunit, a cryobiologist, Sunit Mukherjee, a cryobiologist, who was Subhash's colleague, writes to the CM of Mamata Banerjee seeking the rebirth of Subhash Mukherjee's Memorial Reproductive Biology Research Center. So at that particular time in India, the first IVF baby that was born was Harsha, and this was achieved by T.C. Anand Kumar, who till then was known as the father of India's first test tube baby. But 16 years later, when Sunit approached Kumar and showed him Mukhopadhyay's notes, his handwritten notes about this, so T.C. Anand Kumar stepped down from the position and let the work of Dr. Subhash be known to the world. So Dr. Subhash created history when he was working with Dr. Sunit, and he became the first physician in India and the first in the world with British physicians to achieve fertilization, resulting in a test tube baby. And a healthy baby was born on October 3rd, 1978, who was called Durga. Unfortunately, yes, he faced a lot of social condemnments and bureaucratic negligence, reprimand and insult instead of recognition from the West Bengal state government, and refusal of the government of India to allow him to attend any international conference and to explore the knowledge in the field of IVF. Bengal government at that particular time, when Dr. Subhash claimed the procedure of IVF, they appointed a bureau which had a gynecologist, a neurophysician to examine the claims of Mukhopadhyaya. And he committed suicide in his residence in Calcutta on June 19th, 1981, after he was humiliated and insulted by the committee. So it is a very sad thing that the scientists in India are not recognized for their work, and they are just coined to be mad scientists, or the ones who coined for their unethical, even if it is a milestone that was achieved. Mukhopadhyaya had undergone all these humiliation to such a level that he decided to end his life, saying that he couldn't wait for a heart attack to kill him for years. So that is a very saddening thing. And his feat has been given belated recognition as an Indian physician who in 1986 was officially regarded as being the first doctor to perform in vitro fertilization in India. His recognition is attributable to T.C. Anand Kumar, who is credited to be the mastermind behind the India's second, officially the first at that time, second test tube baby. Kumar came to the conclusion that he was not the first after reviewing Subhash's personal notes. He was helped by Sunit Mukherjee, who was one-time colleague of Mukhopadhyay. Kumar was involved in setting up a research institute in reproductive biology in the memory of Dr. Subhash. So it's just a saddening thing that Dr. Subhash did not get the recognition what he deserved at his time. So as the IVF world advanced, so since the birth of Louis Brown, many technologies or many techniques are coming into light. So as we are advancing in the IVF world, yes, majority of the IVF centers have come up, and the majority of the clinicians or the gynecologists are taking infertility as their specialization, and many techniques have come up to help couples to have the happiness of parenthood. So in 1994, pregnancy following fertilization with the sperm cells retrieved from the testis or the surgically retrieved sperm cells was achieved. So until 1997, so a blastocyst transfer, which is a very common thing as of now, a day 5 embryo transfer was not practiced until 1997. So 1998, mitochondrial transfer between oocytes, 2001, single embryo transfer and achieving pregnancies out of it, and 2004, the first pregnancy following implantation of an embryo obtained from frozen ovarian tissue, and the list goes on. So till today, the techniques are being revived, the techniques are being revisited, and every patient is therapeutically approached. Every patient has every couple has its own tailored therapy to undergo to achieve that particular happiness of parenthood. So the latest advancements in IVF technology for transforming the landscape of fertility treatment, from genetic screening to time-lapse monitoring, time-lapse embryo imaging, the artificial intelligence, yes, a very new thing in, the ongoing thing in IVF world, incorporation of artificial intelligence in our daily procedures, and improved culture methods. These innovations offer hope to couples struggling with infertility. As research and technology continues to progress, the changes of success in IVF are steadily improving, making the dream of parenthood a reality for more individuals and families worldwide. So from the birth of Louis Brown till today, technologies have been development in the technologies have been continuously progressed. Though it is slow, the progress is very evident. So therapeutic IVF. So evaluation and preparation of the infertile couple for IVF would be the first step in therapeutic IVF. A thorough evaluation of the infertile couple before the IVF is critical in achieving the best outcomes and avoiding complications, and also to understand the physiology, or to understand the physiology, and to understand the method of treatment that is given to each couple. Most IVF centers organize the evaluation by using a checklist that the nurse coordinator and the physician assure is complete before proceeding with the cycle. So simultaneously, if a couple is seeking for IVF treatment, the male and the female will be screened simultaneously, and these would be the basic evaluations for the female profile. The antral follicle count or the basic scan would be done, baseline scan would be done, and the hormonal assay, of course, to understand the endocrinology of the female body, of that particular female body, and scans for uterine and tubal abnormalities. So there are multiple factors which will be causing fertility in a female. So whether it be a uterine factor or a tubal factor or any other hormonal imbalance. So a thorough evaluation is very much required for both males and females. So evaluation of males, of a basic evaluation includes semen analysis, a very basic procedure what a male has to undergo, a very basic test a male has to undergo for infertility treatment. In some some cases, for some males, a hormonal assay is also recommended, and semen culture and sensitivity only if it is indicative cases, and sperm DNA analysis also in indicative cases, and also evaluation of sexual dysfunction in the couple is also taken into consideration. So general health and psychosocial aspects of the couple also plays a very important role in achieving this parenthood. So stress, anxiety, and depression have also been linked to lower IVF outcomes, and psychological interventions improve the chance of success. Also, the lifestyle of the couple and the habits, the social habits of the couple also will be considered while evaluating the couple. So, therapeutic IVF is more or less personalization of treatment. So the main objective of individualization of the treatment in IVF is to offer every single woman the best treatment tailored to her own unique characteristics, thus maximizing the chances of pregnancy and eliminating the iatrogenic and avoidable risks resulting from ovarian stimulation. Yes, ovarian stimulation to date is considered as an enigma to break in individual females. There are tailored or there are particular treatments which are designated to their own characteristics. And yes, as we mentioned earlier, that each and every female is different. So they will personalized treatment is not a new thing in medicine, but it was a little it was a new concept in the field of IVF then. So personalization of treatment in IVF should be based on the prediction of ovarian response for every individual. The starting point is to identify if a woman is likely to have a normal, poor, or a hyper response and choose the ideal treatment protocol tailored to this prediction. So the objective here is to summarize the predictive ability of ovarian reserve markers such as AFC, antral follicle count, and AMH, which will be included in the hormonal assay, AMH, which decides the ovarian reserve in a particular female, and thus the therapeutic strategies that have been proposed in IVF after this prediction. The difficulty here is derives from the vast number of drugs and choices available for controlled ovarian stimulation, such as GnRH analogs and the gonadotrophin preparations and other adjuvant therapies, and from the lack of a clear evidence-based therapeutic approach for different subgroups of patients. Yes, so it is still an enigma for clinicians to decode in a particular woman as to how to achieve pregnancy, or how to achieve make the couple achieve that happiness of parenthood in a first go. So in conclusion, clinicians usually choose therapies according to the clinical criteria, the most important being the outcome of previous IVF cycles or previous the history of the particular patient of misconception or not able to achieve the conception. After decades of practice using IVF, it is now very clear that one size fits all approach may no longer exist. Individualization of treatment is not new in the field of medicine, although this concept is relatively fresh in reproductive medicine. So in therapeutics, the transplantation of human embryonic stem cell now holds great promise for the treatment of diseases such as Parkinson's or diabetes or any other genetic abnormality, whereas developments in the stem cell biology will lead to a better understanding of infertility, implantation failure, and genomic imprinting and meiosis. So all these are going hand in hand, and many more achievements are yet to happen to achieve IVF pregnancy in a first go, and many more advancements are yet to happen to provide the couple or to provide the infertile couple with the much more scientific technologies or much more scientific approach. So as the world is accepting or has accepted the assisted reproductive technologies to be a part of their diagnosis and the part of their treatment of infertility, it's a great journey from the year of 1970s to 2000s. Thank you.
Thank you, ma'am. Your insights and the depth of knowledge will have an everlasting impact on our organization, and we all appreciate your time and effort you put into preparing for the event. Thank you.